Good morning, good afternoon, good night, wherever you are on this planet. My name is Ophelia Meyer, and I am from St. Vincent and the Grenadines, for those of you who don't know me. By profession, I am a registered nurse. I am also a qualified nurse educator with a master's degree in the science focus on education. Today, as we commence the celebration of Nurses Week globally, I just thought that on behalf of my website, cupidandi.com, that I should bring you something on nurses. My theme for this year's Nurses Week is a healthy nurse is an effective nurse, promoting excellence in nursing through a keen focus on the health of nurses within the healthcare environment. And if we are to focus on the overall health of nurses, this will in turn positively affect those whom nurses come in contact with on a daily basis. And when we talk about health, we often think about food and exercise. But today's theme is not really about food and exercise, but it is about health in terms of the environment and the people within the environment. Some of the areas I have chosen to look at, including, but not necessarily in this order. 1, caring about their physical health. So you care about nurses' physical health. Ensure they have adequate time off between shifts. And when we talk about adequate, what are we talking about when we talk about adequate? We are talking about making sure that nurses do not work more than the stipulated amount of time within their shift. So if a nurse is supposed to work an 8-hour shift, you are to ensure that the nurse works the 8-hour shift. If for any reason that the nurse is asked to work more, then this nurse should be paid and maybe ask permission first and then paid for the time or given back time in lieu. But for me, I think that in terms of whether or not the nurse is paid should be that the nurse's preference. However, in some organizations, nurses do not have a choice. They are called out to work on their time off and they are just given back time off. So it's up to the environment. But the whole idea is to ensure that nurses do not work, for instance, 2 double shifts when necessary, 2 double shifts. Some of these shifts might be 16 hours or even more, because nurses, from what I've read and from my recollection and even from my own personal experience, after a 12-hour shift, your ability to function and to focus declines, especially when you are doing a night shift and you're supposed to be dealing with critically ill patients and medications, and nurses' judgment because of lack of sleep will be affected. And this can be harmful not only to the nurse but also to the patient. To the nurse who makes a mistake by administering a medication because of tiredness, that was in error in terms of maybe she thought it was this one and then gave it and it wasn't the correct medication, this can be emotionally tragic for that nurse. We've had nurses, according to my reading, who have committed suicide because of mistakes they've made. Nurses, when they make mistake, oftentimes they take it to heart and it causes severe depression. So we have to be careful and make sure that nurses get adequate time off. In terms of how many days off is a nurse required to have each week, that varies depending on what institution they work for. In some institution, nurses might have 3-4 days off in that week, and they might work consecutive 3 or 4 day shifts. For me, it's all about balance. So you as persons in authority with nurses, we should always consult with nurses when we are making policies that govern nurses. So it's all about having the nurses on board and hearing what the consensus says regarding time off, time payback if you call them out and stuff like that. It has to be that you liaise with the nurses as policy makers so that nurses get the time that they need, they get the care that they need. So in terms of caring, again, when they are ill, we need nurses to be supported, ensuring that they get the medical assistance that they need, and also to be for others within that environment to be supportive in terms of their care. So if a nurse is ill, we should not have that nurse working. We should be able to give that nurse time off, let that nurse recover before coming back to work. So it's all about caring. The second point, advocating for nurses. Nurses should advocate for each other, and also those at the top who are involved in policy making should advocate for nurses. Remember, your best resource is your human resource, and this goes for nursing as well. For instance, nurses need to be advocated for in terms of leave, special leave when somebody for them is ill, maternity leave when they have a baby, whether it's a male nurse or female nurse, when a nurse fathered or mothered a child, that nurse should be given the time off so that they can assist with taking care of that baby. As to how much time off that the nurse gets, that's something that needs to be looked at, because in some work environments, some countries, nurses only are entitled to 1 month maternity leave. So if this is the case, then these people who are making these policies need to look at it and ask yourself, we are promoting and we are advocating 6 months breastfeeding without food. And so while there are other ways that we can store the milk, is it really considerate to just give a nurse 1 month maternity leave? Also, if the father, because there are cases in which in other workplaces where fathers get maternity leave, even if they are not the one giving the breast milk and all of that, because to facilitate bonding, you need both parents. So in cases where a male nurse asks this question, shouldn't this male nurse be given some sort of leave to at least help his partner with taking care of the newborn? So we have to look out for our nurses, because we are supposed to be walking the talk. So when we are telling parents that they are supposed to be breastfeeding and they are supposed to be doing all of this for their newborn, we are to be role modeling this behavior by putting those policies in place. In terms of salary, we are to advocate for nurses, because nursing is a very rewarding in terms of hearing clients telling you how good you've done and seeing how they recover is very rewarding. But on the other hand, nurses still need adequate pay so that they can take care of their financial needs. When you have adequate pay, then you don't need to worry about how your bill is going to be paid, and then you're able to give even more of yourself. I am not saying that nurses are just there for the pay, but I'm saying, like anything else, getting good pay for work done is encouraging. It's a motivating factor for nurses. So nurses, as much as possible, we should, and those in authority should, ensure that nurses are adequately compensated. And not only with salaries, but in terms of pension and every vacation leave. Some work environment actually pay nurses give them a vacation allowance, travel allowance, on-call allowances. These are things that encourage and motivate nurses to even give more of themselves. Paid for overtime is also needed. Also, in terms of advocating, it's recently I've seen many cases where nurses are being attacked while on duty, and this is very alarming. There is one instance where a nurse died a couple of days after, I think it's a couple of days after being attacked by a patient. Nurses in their daily and nightly care come into contact with patients, and sometimes these patients are mentally unstable for whatever reason. And because of this, we should not wait until a nurse is injured or even dies before we put things in place to ensure that nurses feel and are secure. So in terms of advocating, we should advocate for security. It has gotten to the point where security is supposed to be on nearby at the clip of a finger, so that nurses can get that help before they get injured, and to even prevent the patient from even injuring his or herself. So the security is not just needed for the nurse, but also for the patient. Because I read of another case where a patient, after attacking the nurses, actually went and attacked another patient. So we need to have proper, adequate security on and within our wards, in our healthcare systems, even in the clinics, to prevent nurses from getting injured and also to save patients from themselves and from other patients. So we need those in authority to look at this and start advocating for nurses in terms of their security. Understanding. This is another. We need to create a culture of empathy and consideration. Nurses are adults and should be treated as such, and this goes both ways. A nurse should have an open mind to facilitate growth and trust. Because you are a nurse does not mean that you know everything. So if when you make mistakes, you are not afraid to own up to it, this will be better for you. Do not get offended if corrected, because we learn through our mistakes and by correction. Also, those in authority, so it goes both ways. So the nurses on one hand should be open, but also those in authority, example supervisors, should deal with issues without fear or favor, but also with respect. So as a supervisor, your duty is to listen to nurses, speak your truth based on policies and guidelines without bias. So it's to maintain professionalism within the work environment rather than friendship. So when issues arise, we are to, as nurses and supervisors and those at the head, to deal with these issues without fear or favor and favoritism, so that at the end of the day we do not have anyone feeling disrespected or treated. Oftentimes nurses find themselves in environments where they are feeling victimized, and because of favoritism they do not feel as if they can go and relate to the other nurse or to the supervisors. Or even supervisors sometimes do not feel as if they can relate to the nurses because they may be afraid of how the nurse is going to respond. So it goes both ways. So it's all about creating a culture of understanding, of respect, so that we are compassionate and considerate of each other. And when we have conflicts, we are not afraid to solve them, that we will do so professionally. And this in turn will affect our mental health. And supportive also could go with understanding. So the next point is supportive. Look out for each other's interests at all times. There is room and progress for every nurse. So as nurses and those in authority, we ought to encourage those who lack in things like self-confidence or whatever way, in form of opportunities for growth. So do not hide things. Just share information. Share. You may have learned about a new medication or even a new treatment for wound care, something you've learned and you just keep it to yourself. No, we need to create that culture where we support each other, where we look out for each other, where we share with each other. Remember, sharing is caring. Also, we should lend a shoulder. And this may include in terms of lend a shoulder to cry on. Maybe if another nurse is experiencing a traumatic situation, whether it's work related or not, we should really take a little time just to hug them, just to tell them how much we care about them, show them how much we care. If possible, if for instance I remember when reading about one instance when a nurse was injured on duty, that nurse actually finished the shift. Maybe they didn't think that she was that badly injured, but it will be good for us as nurses when we see other nurses with injuries or in some traumatic situation, even though they feel as if they are okay. We should really ask them to take some time away from the work environment so that they can really get back themselves together. Give them that time so that they get back themselves together. So we are to be shadowing when necessary also is supportive. And shadowing in the sense that sometimes as senior nurses and even junior nurses who are at a higher level than their colleagues, we may see that other nurses lack the confidence that they need, and maybe they're not too comfortable with a procedure or something, and instead of just leaving them on their own, just accompany them, shadow them. Even if it's from a distance, you're looking to see that they are doing the right thing. We have to have each other's back. So shadowing ensure procedures are carried out and are done so safely. And this includes also in terms of supportive, it includes also conflict resolution. As I discussed before, when we have a conflict, we are supportive of each other. We deal with the issue and not with the person's personality, because in a healthcare environment, just as any other environment, we are dealing with people with different personalities and characteristics, and therefore conflict is inevitable. So what do? We should not run away from conflict. Rather, we should create a supportive environment where we are willing to listen to each other and also to deal with the issues and not get personal about the issues. And we see this not only in nursing, where we often, even on social media, we see it when we are having disagreements, we often tend to get personal. And this can cause a decay within the healthcare environment when we get personal. When we have issues, we deal with the issue. Deal with the issue. So if a nurse does something that is wrong, do not attack the nurse. Deal with the issue. See how you can deal with the issue. And if the nurse is attacking you, do not tolerate that. Maybe it's time to just leave and let them know that when they have calmed down, then we will deal with the situation. So it goes both ways. It's about conflict resolution. It's about creating a supportive environment. In terms of a supportive environment as well, we ought to have zero tolerance for bullying. And as much as we often associate bullying with children and teenagers, bullying is prevalent in nursing, as with any other environment. And we see it from time to time where, even if it's not nursing, we see it where colleagues actually get into conflict to the point of getting physical. And we should have zero tolerance for bullying in our work environment. We have sometimes supervisors bullying workers, nurses, and you have nurses even bullying other nurses, and maybe even some nurses attempting to bully supervisors. It goes both ways. So we should not encourage bullying. Any forms of bullying should be dealt with. Let our nurses, let our supervisors, let our workers know that we are professionals and that we do not condone any form of intimidation. When we have conflicts, let us settle them professionally. Let we not go into an environment where we are keeping malice, where we are not speaking to one another, where we are actually telling lies on each other, where we are reporting on each other things that we can settle. Instead of settling, we are allowing it to escalate to the point where we even end up in the court. So we have to deal with issues professionally. Do not click. There's sometimes in work environments we have nurses clicking up on other nurses and making some nurses feel like outsiders. No nurse should feel like an outsider within their working environment. This affects that nurse's mental health, and as a result, it affects productivity, because sometimes nurses like these always feel sick. Sometimes it's not a physical condition, but it could be mentally. So because a nurse feels like they are being bullied, they do not want to show up for work. I can recall instances where I was bullied as a nurse, and there were times when I was tempted to call in sick. However, because of my strong inner principles, I tried as much as possible to live by those principles. And instead of calling in sick, I will get to work, but it was not always pleasant. And this affects your productivity. We should be able to, even if we have differences when it comes to patient care, when it comes to relating with each other, we should be able to do that without any form of like hatred. You know, sometimes you actually feel the coldness. You actually see the coldness, and oftentimes this bullying it's more about personal vendetta. It's about one person trying to get ahead of the other. We are all nurses and we can all get ahead. We have to have that mentality where we can all get ahead. Just because another nurse is progressing doesn't mean that you have to pull them down. Just encourage them and use and look at what they are doing as a role model for you to progress as well. So we can all progress. Do not keep malice. Do not pull down other nurses. Do not try to force other nurses to believe in what you believe. Nurses, they have their own social things that they want to do. They have their own spirituality. They have their own, whatever the case is, they have their own beliefs. They have their own culture. You may think that you're from the same environment, but they are subcultures. So nurses, they are different. So because of that, we have to respect that difference and be able to at least create a culture where we not only tolerate, but we accept each other. We accept each other and are willing to work things out without getting personal. So again, I just want to recap. So I provided a couple of 4 broad headings under which we can deal with a healthy nurse. So a healthy nurse is an effective nurse promoting excellence in nursing through a keen focus on the health of nurses within the healthcare environment. And we said that health is not just about eating and exercise, but also about other things, including caring about the physical as well as mental health of the nurse, and ensuring that they have adequate time off so that they can get the rest they need and get the mental rest that they need, as well as physical, and get time off to do social activities. We also spoke about advocating for nurses and nurses advocating for each other, those at the top advocating for each other as well as for nurses, so that they have the security that they need, the resources that they need, and also in terms of salary, maternity leave, etc. We also spoke about understanding, creating a culture of understanding and empathy as well as consideration, where we respect each other and are willing to be open and to understand each other and to correct and learn from each other. We also spoke about creating a supportive environment where we resolve conflicts professionally, and we have zero tolerance for bullying, where we encourage each other, where we shadow each other, where we promote each other, where we encourage those who lack self-confidence, where we ensure that safety is maintained by those who are not at our level of experience. So we care for each other in a way that when we do this, we have maximum results within the healthcare environment. Ladies, gentlemen, children, teenagers who view this, I just want to thank you. This by no means express all that there is to know in terms of nursing. Again, I want to wish each and every nurse a happy International Nurses Week. Let us be there for each other. Let us support each other. Let us have each other's back. Let us promote excellence in nursing by advocating, caring for, understanding, and supporting each other. Have a great Nurses Week again. Bye.